Hello, my name is Miss Tina Khanam and I'm an ophthalmologist working in London. Today we'll be talking about blepharoplasty. So what is blepharoplasty? See, these are when patients or people come in with baggy eyelids. So it might be on the top lid or the bottom lid. And for the top lid, it might be quite cumbersome and you may not be able to see enough to drive, for example. So you need that for functional reasons. Some people need it for cosmetic reasons because of the bagginess over their eyes or under their eyes with excess skin and fat. So what we do is we have to make sure that we prepare you. So preparation is everything for blepharoplasty. You need to make sure that you're not on any anticoagulants, so you're not on any aspirin and warfarin or things like that. That will increase the chances of bleeding and hemorrhaging. And also, if you're smoking, then we say if you can get take yourself off smoking before the surgery, because that can affect the healing as well. Anything that increases your blood pressure and anything that increases your hemorrhage risk, where your bleeding risk is increased, and smoking. So we prepare you by saying control your blood pressure, get rid of all the medication that can increase your hemorrhaging risk, and also quit smoking. So on the day of the surgery, what we do, we give you local anesthetic. So this is a painless surgery. The only a little bit of an uncomfortable part is when you have the local anesthetic. We make small cuts. We either work on the skin, muscle, or fat below the skin in both upper and lower blepharoplasty. So there's the big risk is hemorrhage, as I said. So after the surgery, we advise patient that you use cold compress to reduce the chances of swelling after the surgery. You may need to take a few days off after surgery, and as with all eyelid surgeries, I say to the patient, you've had an insult, which is the surgical cut that I've just given you. So you will look worse to begin with. When it's recovering, then it gets better. So make sure you use your cool pack to reduce any swelling after the operation, and also no vigorous exercise that can increase your blood pressure and your pressure inside the blood vessels in the eye. So that's blepharoplasty and why you do them, and what precautions to take, and what are the risk factors. You may need sometimes you may need some revision surgery, because the first time we didn't get all of the excess skin and fat and reposition the muscle. So that can happen sometimes as well. And when choosing your blepharoplasty surgeon, again, you want to choose a surgeon that does a lot of these procedures and can handle the risks and the complication that may occur afterwards.